Good morning, everyone, or good afternoon or good evening from wherever you're tuning into. I'm Jonathan Edelheit, Chairman and Co-founder of the Medical Tourism Association and Global Healthcare Resources, and bringing you today our webinar on the state of the medical tourism industry. We have today with us Tim Isenhower, who's Director of Benefits of HSM Solutions. Tim, I really want to thank you for joining us.
Thank you for having me. I'm happy to be here this morning.
So I'm gonna go over some slides and some statistics on a recent survey that we did on the state of the medical tourism industry that we'll be releasing very soon, give you kind of some of the insights and some of the most important facts. And then I was going to jump into a Q&A interview with Tim to really discuss, Tim's company is one of the first adopters of medical tourism into self-funded employers' plans here in the U.S. And I thought that he would really be able to provide some great input on how their company did it and where they're headed. So with that, I'm going to kind of jump into everything. So we recently launched the Medical Tourism Pulse Survey to see what's going on in the industry. And one of the interesting things that we found is, one of the questions we ask is, because we see a lot of gaps in the industry, one having to do with technology, is do you feel you have and use the technology necessary to grow your traveling patient business successfully? And, almost 40% of medical travel professionals say they lack the necessary technology to grow their medical tourism business. And in reality, that's not a surprise. I was actually surprised the number was so low, because most people, we find the medical tourism business is still running off Excel and Outlook and very basic CRMs, and there's a lot of violations of HIPAA and other things of how kind of people are running it. And there's not really software systems that really provide those solutions. The other interesting question we asked was, are adequate or quality medical records and methods of medical record transfer readily available for patients traveling for care? And 43% of the professionals surveyed believe that adequate medical record transfer is not available to protect the privacy of the patient. So I was surprised at that. But then again, every now and again, our association, I think every week, is getting medical records of patients and diagnosis is emailed to us accidentally because people are just kind of sending it through email. What do you believe the most important factors a patient should consider when choosing a healthcare provider in another destination? Is 100% agree the experience or credentials of the medical practitioner is amongst the most important components? 91% feel that accreditation and certification is almost equal in sentiment to the 100%, but it's 91% feel accreditation and certification is important, and 89% believe website information is important in comparing healthcare providers. So another question we asked for hospitals and facilitators is through what method do you prefer to receive patient inquiries? Less than 10% said they're using pay-per-lead agencies or websites. Back in the day, a decade ago, this was where a majority of patient inquiries were coming from, and 51% of hospitals obtained their patient leads directly from consumers coming to their website, which was I thought pretty high. How important is the second opinion process in medical tourism? I thought this was a great question because at the end of the day, second opinions is what drives and leads medical tourism. No one's getting on a plane and going for surgery without an international doctor diagnosing him or telling him what he can actually do for him. And 67% of those surveyed feel that second opinions were critical to the process of medical tourism. I know in some markets, like in China, for example, it's very difficult to get good second opinions or diagnosis. So a lot of patients know something's wrong with them and travel and then get the diagnosis later. And so with that, that was just a little bit of a teaser of the results that we'll be issuing, soon for the comprehensive pulse survey. And so with that, I really want to turn it over to Tim Isenhower, and you really throw out some questions. And also, Tim, feel free to, if you have any feedback on any of the stats we just shared that were insightful, let us know. But, Tim's been really a pioneer in the medical tourism space. And I feel one of the, the first employers to implement medical tourism and really embrace it. And Tim, I would love it if you could maybe tell people a little bit about yourself and HSM Solutions.
Sure. Thank you, Jonathan. HSM Solutions was celebrated in our 75th year of being in business this year. So we are a family-owned business that's been around for 75 years. Right now, we have roughly 3,000 employees. At a maximum, we've had 6,000 with the economy the way it behaved back in 2008. We downsized about that time. So we started looking at medical tourism in 2007. I'm always looking for ways to reduce our costs and not impact our employees' out-of-pocket expenses. So we're a manufacturing company. We have manufacturing facilities in 15 states and about 50 locations. And so it's hard to attract these manufacturing employees in this environment today. And so we felt like putting some innovative benefits would help us attract employees as well. So we've been doing it quite a while. Since 2007, I've lost count how many patients we've sent abroad for healthcare, but it's got to be well over 500-600 employees with huge savings to the company. So it's been a really good program for the company.
Do you have any estimate of how much money that you think you saved over the years?
Millions and millions. You know, when I looked at it, and we were on ABC News probably in 2011, and at that point we had been in the program for 3 or 4 years, and at that point I had estimated about 11 million in savings in those few years. We've expanded this program to prescriptions, doing procedures that aren't commonly done here, to where those savings I think are even more than what they were back in those days. But it's kind of subjective. You don't know what procedure a patient may have in the U.S. versus what they're having in Costa Rica or wherever we send those guys. But the savings are phenomenal.
Mm-hmm. I remember working with Diane Sawyer's team at Nightline on that ABC News episode, and it's been too many years. We need to get another big media outlet to cover it. But I think that was great coverage for not just HSM, but I think for the industry.
Yeah.
From an employer perspective, what compelled you to implement a medical tourism program almost 10 years ago, and what obstacles did you face when actually trying to start this?
So, again, we're spread out all over the country and the world, actually. We have expatriates in China. We had expatriates in Lithuania, the UK, Italy, all over the world. We were already paying for health care in other countries. And for the expatriates, they would just send me their claims, and I would process them through our PPO here in the United States. And it was very obvious the costs in these countries, except the UK, were very well controlled, and unlike the costs we were seeing here in the United States. So I was already exposed to healthcare in other countries through that mechanism. But I went to a program in Raleigh, North Carolina, a facilitator who was sending people to India who had no insurance or had high out-of-pocket expenses on their insurance, and they were going over to India individually. And it was a great conference, I thought, but it was full of HR folks that were just in shock that anybody would get the patient over to India. And the poor guy who was presenting with Indus Health just couldn't get a word in edgewise. I slipped him my card, and we started a conversation. I actually went to India and looked at the hospitals. At that time, we were using Wockhardt in Bangalore, and they were a Harvard-affiliated hospital. So we did a tour of the hospital. We did physicals, get a feel for how the system worked. And it was just unbelievable, the efficiencies and the quality of care that was there, as opposed to what we were seeing our employees get here in the United States. So it was just a good fit for us. And at that time, there was a lot of publicity about folks paying on their own to go to these countries for surgeries just to avoid these out-of-pocket costs.
Very interesting. When you were at Wockhardt in Bangalore, because I was at that facility like 10, 12 years ago, really beautiful facility at the time, the patient rooms. Did you go out on that? They had like a patient deck. It was interesting because it was like 5-star facility patient deck, but then it kind of also overlooked the poor neighborhood. I'll say, to be politically correct, but it was very interesting of the, I think India provides a unique where you've got poverty, you've got wealth, all combined, and it's an interesting. It's not for everyone from a medical tourist perspective because of that. I think diversity. How did your employees perceive, and were there any issues with that, or did they love India?
Some people loved it and some people hated it. I personally loved it. The culture there is so very, very different. And yeah, I'm familiar with the hospital yard they had. All of the international patients had this deck or courtyard of a garden that was beautiful that they would see outside their window. But again, you look out the other side and you do see all the poverty. And a lot of people were either humbled by that or horrified by it. And it was difficult for some people going that far away from home and in that different environment, they would get homesick. The phone would be ringing at 10 a.m. Employees looking for a Taco Bell. It was pretty difficult. But those who did embrace it and love it, they did very well. But being such a far away and different place, we realized we had to find something a little closer and something that also would appease our Hispanic employees. About 20% of our employees are Hispanic.
What benefits did participants see, and what were some of the savings and outcomes that you've seen from your program?
The first thing we saw, which was very interesting, was the misdiagnosed procedures we were having treated here in the United States. We sent a lady from Tupelo, Mississippi to India for a gastric procedure. She had gained all this weight and they couldn't figure out why. She couldn't get rid of it. But when she got to India, they're very thorough. Wherever we send them, they're very thorough. They do all kinds of free tests. But they discovered this lady had a pituitary tumor in her sinus cavity that was likely causing this weight gain. So they did not do the weight loss procedure. They did remove the pituitary tumor, and the lady came home and she was treating for that here in the United States. We had a fellow who here in the Hickory area was lined up to have a hip replacement, and we offered a second opinion to any employee who's having surgery to those doctors in India to look at their files, look at their records, and give an opinion. Well, this guy with the hip replacement, we sent his records to India, and the doctors there said, well, yeah, you do have a hip issue, but we see a back problem. And the guy went to India and had his back fixed, came back, and he was fine. So that was a surgery that would have been duplicated had he had that hip replacement here. He would have obviously had that back procedure later on. That was the first thing that stood out to us, the misdiagnosed and procedures they were doing here that they shouldn't have been doing. Our employees became healthier. People embraced the program. It was very difficult to roll it out. I mean, India is such a faraway place. We were going out to every location and explaining to our employees this option that they can have the procedure there at zero cost. We didn't have anybody take us up on it until the very end of that open enrollment period when we were explaining it. So we had one guy in this Hickory area decide he was going to go for his knee replacement. And once we got one guy going, we went back and told his story, and others followed.
I'm really glad you talked about the misdiagnosis part, because that's something that I talk about all the time, but you don't really hear anyone in the industry, not just in medical tourism, but I feel like in self-funded healthcare, the big issue with misdiagnosis is that employees, they don't know who the best doctor or hospital is. And if they go for care locally, whatever that doctor diagnoses, they think they have. And I think one of the hidden secrets that I've seen in medical tourism is if you're dealing with the top surgeons at the top hospitals, whether it's in India, Costa Rica, Cayman Islands, that, they're catching these, and providing alternative diagnosis. And it's not like it's a rare case. Sometimes it's, the statistics are pretty significant. So that's great that you've seen that firsthand.
Yeah.
What, when you first rolled this out to generate interest, what incentives or savings, did you offer? Because I've seen back in the day, there was one insurance company in South Carolina that rolled out medical tourism, and for the first year or two, they provided no incentives to the employees to go abroad. So in reality, if you had to pay your own airfare and hotel plus deductible and co-insurance, it was more expensive to go abroad than to receive care in the Carolinas. So how did you kind of overcome that?
Yeah, what we did when we offered it to our employees, and we still do this, is The employee is able to travel to the destination where they're having surgery at no cost. They can bring a companion at zero cost. The surgery itself costs nothing to the employee, whereas here in the United States, depending on which plan they're in, it could range anywhere from $3,000 to $5,000 out of pocket. So the employees are saving that out-of-pocket expenses to begin with. We also offer a medical bonus, which is 20% of what that procedure saved the company, up to $10,000. So, a lot of people were shocked by that. So when you're just paying people to go have these procedures, don't see it that way. We're trying to work in the best interest of our employees, and we're just sharing the savings that they're generating for us, and that certainly generated interest by doing that.
So what is the most that like a patient has saved or received from a procedure or a drug? It could be even for treatment.
We just had a prescription actually last weekend. We had a fellow who was diagnosed with MS. He's been diagnosed with MS for many years and been on various infusion therapies. He went to the Cayman Islands for this infusion therapy. When we caught it, he had his first infusion here in Hickory, North Carolina back in January, and it was $198,000 for that one infusion that was broken down into two therapies. So the second infusion was coming up in July. That would have been another $198,000. We were able to send him to the Cayman Islands, have that infusion there. He took his spouse with him for $26,000. So he got the big $10,000 bonus for the savings there. The backs are huge savings. They do the disc replacements are very, very expensive here in the United States. Depending on where you get those disc replacements, the replacement itself can be a couple $100,000. We asked the folks in Costa Rica, we've got a great neurosurgeon down there. We asked him about the replacements. He was concerned about doing them down there because the replacement part is $13,000, which was huge savings for us. But when you do a disc replacement, a back, cervical disc replacement in Costa Rica versus here in the United States, the savings can be several $100,000.
That's a huge difference in cost. Yeah.
And, we don't send a lot of those happen several times a year. We send a lot, a knee replacement or a hip replacement, we're saving $20,000 to $30,000 per procedure.
Are you finding that, medical tourism is one of the biggest drivers of like cost savings or controlling, the rise of your healthcare plan costs?
Our healthcare costs went down 20% this year. We're just trying to figure out where all this is coming from. And our turnover has pretty much ceased. We've got the same employees. I feel like offering this great service to our employees, these folks are fixed. They've had their knee replacements. They've had their hip replacements. They're not suffering and going to the emergency room and driving up our costs. So I feel like it's a big cost saver to our program. Very big.
So with what you just said, are you saying that like you're feeling that because they can get the procedure kind of cost effectively and save, this is reducing ER visits and other things from them just, having that condition just?
Definitely. I think it's decreasing. We've got a terrible addiction problem here in the U.S., and it starts with someone with a knee issue or hip issue that's going to their doctor. They can't afford to get the surgery. They're on the narcotics. By the time they get their surgery, they're addicted, and it's a terrible situation. Our employees have access. We have on-site clinics. Our nurse practitioners can order imaging for employees when they need it, and so they get fairly quick. We have a physical therapist that will see these folks originally, and he'll sometimes circumvent a surgery, but he'll know whenever someone's in shape that they need a surgery that we can get them fixed pretty quick. So the ability to get someone repaired very quickly has saved us in workers' comp, and we don't treat workers' comp in Costa Rica, but we saw a drastic reduction in Monday morning injuries. For example, if someone was out playing basketball over the weekend, injured their back, they may come in Monday morning knowing they've got this $3,000 out of pocket, and workers' comp pays 100%. They don't have to do that anymore. They've got this mechanism through the health plan where they can do no out-of-pocket expenses. So the cost savings trickles over to new areas.
That's great. So it sounds like there's been a lot of hidden surprises that you found when you rolled this out. With the one thing you said is you had a lot of employees that were holding off because they couldn't afford to get to surgeries. And if we look at that side, because I feel like there's a lot of employers out there, a lot of brokers who don't, they may have great benefits themselves, know who the best hospitals are, not have to worry about deductibles or co-insurance and things like that. And so for them, they don't really see, more of the average employee, issue of, not having the money for deductible or co-insurance and holding things off. Can you explain that a little bit to those who don't necessarily, see that right off the bat?
Again, we're manufacturing. We pay an hourly rate for our employees to do the jobs they do. We pay as well as we can within the environment we're working in. So these employees are making, maybe $40,000-$50,000 a year. An out-of-pocket expense of $3,000 to $6,000 is huge to these guys, and if they have family members with healthcare issues as well, they just simply can't afford it. And by going through our on-site clinics, which is free to them, we can find these conditions and issues and direct them properly to get them fixed properly, quickly, with great quality and outcome when they need it.
Well, one of the things that sometimes I hear is a criticism of medical tourism. That people aren't really doing tourism. They're not, and it's not a vacation. But I remember we did a documentary almost a decade ago with a gentleman from Orlando, Florida, who went to Costa Rica for a double knee replacement where he had never left the country. And he was so excited to go to Costa Rica and do tourism and eat from the local street vendors. That was the most exciting part of his trip. Do you find that tourism plays a role when someone's going? Are they bringing companions? How long are they staying? Are you covering those expenses? When someone goes for infusion therapy to the Cayman Islands, is this something that it's stressful or a struggle, or this is a better, more relaxing environment for them to get their treatment in?
Our employees love this program. They think it's a very relaxing. It's a great way to get health care. I mean, if you're having a knee replacement here in the United States and your husband or wife works somewhere else, you've got 2 or 3 kids at home, you have a hard time recuperating from that knee replacement when you're taking care of the kids and cooking for them and those kind of things. When you're in Costa Rica or Cancun or Cayman Islands, wherever you go, you're treated like a tourist, but you are a patient. You're treated very well. You have this patient advocate that takes you around everywhere you go. They take you through the hospital. They take you through the city. And a lot of our employees have never even been on an airplane before. So it's very exciting to them. They look at it as a tourist adventure, but we tell them this is a medical procedure. This is serious. You're not going down there for tourism. But we do, at the end of their stay, pay for a tour. For example, down in Costa Rica, they may go see the volcano, or they may go to a coffee plantation. Some people have had their spouses do tours while they're out. We do pay for one tour for the patients while they're down there. It can get lonely down there. You can be in a hospital for maybe just a couple of days, and you may be in a hotel for as much as 2 weeks, depending on the procedure you're having. Most procedures, you're down there about 10 days. That's for knees and hips. Back may be down there 2 weeks. But people enjoy it. I mean, they relax. They enjoy the food. They have no out-of-pocket expenses, and they come back enlightened, actually. But they feel another culture that they would never have seen before had it not been for this program.
And when you say, no out-of-pocket expenses, airfare and hotel for the patient, what about a companion?
The companions, we pay for the companion as well, pay for all the hotels, all the food. They have a meal program at the hotel where the employees can go down and eat anytime they're hungry. They can use room service if they wish. It's very accommodating.
What about, is it, do they always are they getting economy tickets, or are they sometimes getting business class tickets, or how does that work?
We will normally send business class. if you've had a surgery, we want you to be comfortable. We want you to be comfortable when you go down there. Again, a lot of our employees have never even been on an airplane before in the business class. Makes them feel comfortable and relaxed. And it may cost an extra $1,000 to do that, but the savings we see and the procedures we're having well offset the cost of that business class ticket. But we prefer to send them business class.
I think that helps really transform the experience too. Did you get any pushback from local healthcare providers in North Carolina when you rolled this program out?
We did. It was mainly from local surgeons. I had one local surgeon show up one day. He actually called me ahead of time and said he wanted to take me out to lunch. Very polite, very nice. But when he got here, he was very angry. He says, "Look, I don't need much time with you. I don't want to get in your face. I just want to tell you what problems you're generating." I said, "Oh, okay. Well, let's not go to lunch. Let's go to my office." And we discussed it. He said, "I'm tired of treating all of your patients that go down to wherever they go and come back and have to treat them in the emergency room." And I said, "Really? I wasn't aware that was going on." And tell me a patient you've seen in the emergency room, because that's not our goal. We don't want people being screwed up somewhere else and come back here and be fixed. And he couldn't name anybody. He said, "Well, maybe I've got my facts wrong." I said, "Sure, you got your facts wrong, because I keep up with these patients. They're not falling up in the emergency room when they get back." And he says, "Look, we want a piece of this. Let us help you do this program. Let us help follow up with patients. We'll even give you a cost for the procedures locally that you're having abroad." And I never heard back from the guy. He just never responded back to me. The local hospital, they actually work with us. We use a direct contract to do the imaging at the local hospital wherever we are. The providers, when people come home, some are reluctant to treat them. Others are very excited to treat them. So we find physical therapists that help them when they get back. But it's a mixed bag when it comes to the perception that the local community sees. And I think that's what keeps a lot of employers shied away from the program. They're worried they're going to upset their local doctors. You got to get over that piece if you want to see some of these savings.
Mm-hmm. Yeah, I think that's a misnomer. I think a lot of people, and I hear it constantly, people always ask me that question. So what happens? Like who arranges for the, when the patient comes back? Is it the patient? Is it the employer? Are these providers refusing to see these patients? And I think so a lot of employers are concerned about implementing this because they feel like their employee is going to come back from the procedure and no one's going to touch them.
Yeah. I'm going to give you an example. I'm a big skier, and I went skiing out west, and I ruptured my PCL, which is the tendon in the back of my leg. So I didn't even know what was wrong. I went to my local doctor here, orthopedic, and he knew who I was, and he was all upset with me. He said, "You're going to go to Costa Rica, aren't you?" I said, "I don't even know what's wrong. Please help me here, So he schedules an MRI, which I don't have scheduled for 2 weeks. I ended up going through our local clinics to get my MRI scheduled through our clinics. And by the time I get my MRI scheduled through this clinic, I've already got a surgery date. The guy's going to replace my PCL, whereas the doctors here were telling me I needed a replacement. But this guy was really adamant about not participating with anything in Costa Rica or our global program. But we started a program, or we looked at a program with Nash Hospital in Cancun, where they were actually flying doctors from the United States to Cancun to perform the procedures on a Saturday morning. The doctors in Cancun follow up with that patient, and you follow up with your doctor when you get back to the United States. Well, lo and behold, the first doctor to sign up for the program was the doctor that treated my knee, that told me I was going to have a mistake if I went abroad. He just wanted to fly abroad to do surgery for. So it's pretty interesting to see how they behave when they can get involved with it with us.
When you were talking about that surgeon coming in and saying he was seeing your patients in the ER all the time, which wasn't true, is having sent hundreds of patients to other countries. You must have seen complications. Like how are complications handled and how often does it happen? Because that's the other big objection we hear from employers is, oh, I'm going to send them over, I'm going to save 50 to 90%. Then they're going to come back and have a complication, and it's going to cost twice as much, and therefore there was no savings.
Yeah, The complications where we send our folks are very rare. I mean, again, we may be sending a patient to Costa Rica, a very small country, but we're sending that patient to the best doctor in that country. So these guys operate on their presidents. I mean, these are the best doctors they have. So there are very few complications. We've had a couple of complications on a back surgery, which I see more complications here locally with backs than I do in Costa Rica or wherever we send these guys. But the one complication we did have in Costa Rica on a back, the patient had her surgery, was not doing well afterwards, so she was not allowed to even come home. So they actually worked with her. They went back in, they repaired it. She was in Costa Rica about 25 days. So when she came home, she was fit. We've got patients here locally in Hickory, North Carolina. They go for a back surgery, and it doesn't go well. And the doctor says, well, it's just you. It's something you've done, or your body's not accepting the procedure. And the patients put it off. With this global program, that doesn't happen. These doctors are accountable, and they fix anything that didn't go well, which has happened maybe less than one handful of times since we've been doing the program.
That's a great benefit, because I know at the end of the day, even if there's a complication, what we find is that patients usually just want a doctor to acknowledge it and then actually fix it or address it. Where sometimes in the U.S., I think because of medical malpractice lawsuits and stuff, a lot of times if there's a complication, sometimes the doctors are kind of taught just to kind of shut down and not address it.
Yeah. If I sent all the patients that we've sent to abroad for surgery to our local hospital here, we probably would have 10% of them infected, some type of infection. We've had zero, and I'm knocking on wood, of infections on these patients going abroad. So that's another less complications we're seeing abroad than we see here locally.
I'm really glad you shared that, because I've seen some fear factor in the media too. Patients, shouldn't travel abroad. It doesn't matter what country they're coming from or going to, because they're going to catch an infection or they're going to catch MRSA or something to that effect. So I'm really glad you've addressed that. When the patients come home for follow-up care, who's responsible for making sure that they have a doctor or someone to see them? I know you said you partnered with a rehab company or something to that effect.
So our facilitator, Indus Health, they make sure the patient themselves will go to their local community if they're not within where we have a direct contract. So they'll go to their local community and find a doctor they've seen. Usually it's a primary care doctor who will follow up with that patient. Physical therapists are willing to help the patients when they get back. The specialists are kind of standoffish, but there's not a lot of follow-up care when they get back, because they're at a point of healing that they don't need a lot of follow-up. They do need the physical therapy, but they don't need a lot of follow-up care. I lived in Houston, Texas 30 years ago, and I had back surgery in Texas way back when, and I don't think I ever followed up with that doctor after the first couple of times I had my procedure, moved back here to Hickory, North Carolina. It's the same thing to me. I mean, it's no different than having a surgery in another state.
Now, another fear factor point that comes up is employers or brokers thinking, if I roll out this program, complications are going to happen, and I'm going to get sued and exposed to tremendous liability. Like, how would you respond to something like that? Because it sounds like you haven't had complications. You're sending them to the best doctors. This is not something that has been an issue in 10 years since you've been doing this.
Yeah, a lot of brokers say that. They're saying, you're telling this patient they need to go to this location to have a procedure, and if it's a complication, that's your fault. But it's not my fault. I mean, it's no different than having a TPO contract here in the United States. You're telling patients where to go to that doctor. The program is voluntary. Nobody has to go abroad for surgery, but a lot of them choose to do that on their own. I've just not seen the complications that would require someone to become angry and want to sue us, like I do here locally.
Mm-hmm. Now you've how you talked about your MS patient going to Cayman Islands for infusion therapy, how much do you see the pharmacy tourism really growing in the future? I think you saw the news, even was it like a couple weeks ago, they came out with the most expensive drug ever. I think it was like $2.1 million for a treatment. And how big of an impact can pharmacy tourism actually, affect HSM?
Well, I think the pharmacy piece is what people really need to look at now. This MS prescription is just a drop in the bucket. I mean, there's a lot of them. You got Harvani that treats hepatitis C. It's $120,000 here. You can have it somewhere else for $11,000. It's huge. This patient that was the MS patient who had already incurred $198,000 in expenses was on our radar for the stop loss company. We have our renewal for October 1. So they pinpointed this one patient and said, look, this guy's headed for another infusion. You want to be at $400,000 in July. We're going to laser that fellow. What that means is they're going to increase the liability to HSM for that employee because he's unhealthy, because he's getting these expensive treatments. By sending him to Cancun is where he went. By sending him to Cancun, the stop loss carrier extracted that laser and reduced our renewal. So it has a big impact on all kinds of places. Your stop loss contracts, the bottom line cost.
That's exciting to see the big impact that it has. Not only big impact, but to see the employees embrace it, that you're embracing it as an employer, with all these positive outcomes.
Oh, yeah. And this employee who went to Cancun, he took his daughter with him. Actually, I think it was his daughter with him. And they stayed, an extra 5 days to enjoy the beach. He had this infusion therapy, so he was healthy enough to enjoy the beach. And also, he had a great time going down there. He's already planning his next trip.
That's nice. I feel like the patients with infusion therapy for the pharmacy side, it's easier for them to engage on the tourism aspect because they haven't really undergone a procedure. And if it's infusion therapy, I also feel it's a more relaxing environment for them to be in than in a hospital setting here in the U.S. or just being at home.
So we have several AIDS patients that go to the Cayman Islands every quarter. So they'll go down every quarter for their medication. So they leave on a Friday afternoon, so they miss half a day of work. They see the doctor Saturday morning. They get their prescriptions that Saturday. They get a day at the beach, and they're home Sunday night. So that person's missed a half a day of work and was able to get their prescriptions for 90 days. And then they're going every 90 days. Their Sunday is just consistently going.
That's nice. Where do you see medical tourism growing within the employer market and also the future of it, especially with the upcoming 2020 elections?
I get a lot of calls from employers very interested in the program. I know here locally in this North Carolina area, we've had about 4 or 5 big employers start a program just in the last few months. I see it growing tremendously. I saw President Trump on TV just a couple of weeks ago talking about the high cost of prescriptions and that part of the federal program should be the allowance of a state to go abroad to purchase medications at a cheaper cost. So even President Trump's talking about tourism, medical tourism in the pharmacy area. So I don't see it shrink. If this Medicare for all happens, which I can't see how the country can afford that. That may be a detriment to the travel program. But as of now, I don't see it doing anything but growing.
So, no, I really appreciate your insights. And one of the things is Tim's going to be joining us as a speaker at our 12th World Medical Tourism and Global Healthcare Congress, which is taking place in Abu Dhabi this year in partnership with the government of Abu Dhabi, October 15th to the 17th. And I just kind of wanted to share with everyone a little information on the event. And we also have a special offer for everyone on the event. The theme of this year's conference is breaking down barriers. So we're breaking down the barriers of access to the event. Last year, our event was $2,000 US. This year, we have a basic free registration so that everyone can attend. We're also hosting it in Abu Dhabi because there's about 100 countries that can participate and get a visa on arrival. One of the things in the U.S. the last couple of years is it's been very difficult for international participants to get visas. And some of the supporting organizations are the Department of Health of Abu Dhabi and Department of Culture and Tourism. We're really excited because Abu Dhabi, besides being a great destination for the event, they're launching a huge initiative in medical tourism to make them a top destination. And it's amazing what they've built over there. They've got the Louvre that they built. They're building a Guggenheim. They've got the Grand Mosque. They have all these theme parks, and there's thousands of islands in Abu Dhabi. It's really beautiful. But the event's all about creating new partnerships, networking with the senior leadership in the Gulf Coast countries like Saudi, Kuwait, Oman, Bahrain, UAE. But we're bringing in attendees from over 90 different countries. We're bringing in big delegations from China and Africa. It's all about growing new referral markets and leveraging centers of excellence, and also having great speakers really share case studies, success stories, where you can hear, success stories of how like Tim rolled out medical tourism, how other insurance companies, employers, and governments from around the world are doing it. You're gonna be able to pre-schedule one-on-one networking meetings through the networking app that we have, so you can see who's coming and actually, schedule meetings at networking tables. It's going to be a more exclusive event this year. We're actually not having the exhibit hall, but kind of sponsored networking tables, so it can be more focused on education and also on people being able to meet each other. And we're going to have some really great topics: genomics, the future of health insurance, healthcare, really some cutting edge things. And Abu Dhabi supporting us with a huge hosted buyers program where we're flying in insurance companies, facilitators, travel agents, ministries of health, from about 100 of them all into for the event. And we also have our certified medical travel workshop, which is happening the first day of the event, where you can come and spend all day and get certified in medical travel for the business of it. And this is just some examples of some of the speakers that we have from Daman, which is the national health insurance company in Abu Dhabi, the main one from the Abu Dhabi Department of Health. We have some great speakers from AXA, Bupa, Cigna, Aetna, Cedars-Sinai. So we're bringing in a lot of major players from all over the world: Russia, insurance companies rolling out VIP medical tourism programs, Chinese medical tourism facilitators. So we're really excited this year because I think it's going to be our most elite conference that we've had in the past 12 years. And we're excited about the level of speakers that we're bringing in. Like Emirates Airlines moves, I think, about 10,000 patients a year around the world because they have airline pilots who have rotator cuff issues and flight attendants. So we're going to be learning really diverse models of how employers with different employee bases around the world, multinationals, how they actually handle their medical tourism business. And also focused on the future of healthcare, because at the end of the day, patients are traveling to destinations that are the most advanced. So what are different hospitals, what are different governments around the world doing to create the most advanced healthcare system there is? For those who are on the call today, we also have a discount of 15% off if you wanted an upgraded VIP pass, which we call the premium pass or the networking pass. There's a code here for 15%. It's Abu Dhabi MT15. And the basic free pass gives you access to all the event and the sessions. But then if you want to be able to go into the B2B networking meetings, there's a $500 registration pass or the premium pass, which gives you access to go through the certification and get access to special things at the event. I really hope you can come this year. I'm excited for our event because I think it's going to be totally different, and it's really focused on, as I said, breaking down the barriers, disrupting the event. Tim, I really want to thank you for being a presenter and speaker today, because I feel like you hit on every single point of what are the positives of implementing the medical tourism program into, like an employer's self-funded plan, but also what are all the objections and challenges that people think about immediately. So, you just created some really valuable insight, and probably one of the favorite people that I've interviewed so far.
Thank you.
Any parting words of wisdom before we close this baby out, Tim?
Appreciate everybody who's attended this morning or this afternoon, wherever you are. It's a great program. We're proud of it. Our employees love it. Our employees embrace it. And I hope each of you will and someday get to experience it as well. So thank you so much for tuning in. I really appreciate it. I hope to see you in Abu Dhabi.
Thanks, Tim. Take care. Have a great week.
Thanks. You too.